pop up. Right, perfect. Well, thank you all so much for joining us today for this webinar on community grants. My name is Star Jones. I'm the Cancer and Chronic Disease Prevention Unit Manager at the Wyoming Department of Health. And within that unit is the Wyoming Cancer Program, the Wyoming Cancer Resource Services, the Wyoming Cancer Coalition. And I've been in this role for 7 years and have been working with WBCI on many different projects throughout that time. So today's presentation will be focused really on the community grants, what they are and why they are important. So I'm sure that everyone on this call knows that 1 in 8 women will be diagnosed with breast cancer in their lifetime. And according to the most recent data, breast cancer is still the 2nd leading type of cancer and is the 4th leading cause of cancer-related death. So we all know that early detection is the key to fighting breast cancer. Not only does it increase the chances of survival, but the earlier it's caught, the more treatment options are available. So almost 98% of women diagnosed with breast cancer at earlier stages live for 5 or more years after their cancer, compared to only 31% for those who are diagnosed at a late stage. Breast cancer is the highest treatment cost of any cancer, accounting for 14% of all cancer treatment costs. The average per patient cost for medical services for late stage cancer is double that of early stage cancers. So overall, breast cancer accounts for $29.9 billion of the total medical costs in the US annually. So obviously, this is a huge issue that negatively impacts us as a society, but also as a state. So as far as the state goes, this is how we're doing. Of the 580,000 people that live in Wyoming, about half of them are female. And according to the most recent behavioral risk factor surveillance survey, 59% of women living in Wyoming reported having their mammogram in the last 2 years. Now, in 2020, that number was 62%, but obviously it's dropped just a little bit post-COVID, which really should not be a surprise to anyone. 14% of our population is insured, so that means 86% of the state does have insurance. Sorry, I flip-flopped that. 14% does not have insurance and 86% does. And what I really wanted to highlight here is that according to the data, there's still approximately 40,000 women living in Wyoming that still need a mammogram. So just as a side note, if you'd ever like to know how your county is doing on breast, cervical, or colorectal cancer screenings, we have this lovely interactive map on our website. In addition to screening rates, it also outlines various risk factors. And we keep this map updated whenever new data comes out. So as soon as I'm done presenting, I will drop the link for this in the chat box so that you can all go and take a look at how your county is doing. So now that we've kind of gone over the data and why this is important, let's kind of get to why we're here today. You're all here because you're passionate about fighting for breast cancer, against breast cancer. You've either applied for a community grant in the past, or you're interested in applying for a community grant this year. Community grants are really important because they provide opportunities that might not otherwise occur. They help us fund some of the most vulnerable members of our communities. They help provide funding to cover gaps in resources and services. They're a great opportunity to pilot unique ideas that might not be eligible for other funding sources. So when we think about these community grants and the ever-changing environment that we live in, we really want to be striving for change. We should be looking at what we've done and thinking about how to improve that year over year. So if something worked really well, we also need to be sharing those success stories and lessons learned with others so that we can all learn what works for Wyoming and what doesn't. So over the last few years, the community grants have focused on things like hosting screening events. We've seen events where clinical breast exams are performed and mammograms are scheduled for later. Others that are held at radiology facilities where mammograms are completed on site. Some where appointments are scheduled after hours or on weekends, and then others where walk-in hours are offered. Some grants have focused on patient navigation, mental health, and support groups for those with cancer, and other grants have focused on providing resources like transportation, lodging, and breast boutiques. So these things are all amazing, and we really love to see these things continue to happen. But community grants can also include other things, and so we just kind of wanted to touch on some of those things today. They can include things like reminders to screen, scheduling assistance, translation assistance, making paperwork easier to complete. So this year, we really wanted to encourage you to look at your grant application and think about what action you're hoping to achieve. Are you focused on increasing access to cancer screenings or completion rates for screenings? Are you focused on increasing survivorship support? Something else? We really want to help you take your application to the next level. So today I really wanted to share some information on evidence-based interventions and how you can implement those into your community grants. Evidence-based interventions are projects that have been researched, tested, and proven to be effective. So I'll spend a little bit of time outlining more of these projects and how we've seen them implemented in Wyoming. Our hope is that some of these ideas will spark you and your team to come up with something truly creative for your community grant this year. So the best thing about working on cancer is that we aren't doing it alone. There are tons of organizations out there who are focusing on this topic. There's tons of research. So there's a lot of research, available resources. I'm going to go over my go-to resources. And the first one is a searchable database of evidence-based programs that others have already implemented. It includes things like the flyers, posters, mailers. They've already created them. They've tested out the language. So you don't have to reinvent the wheel. You can just update it to meet your needs. The next one is the community guide. It's the gold standard for what works to protect and improve population health. This website is evidence-based recommendations about the effectiveness and impact of health programs and services used in a real-world setting. And then the last one is the CDC just created these cancer screening change packages. They're designed to help clinical teams with practical tools and resources that can be used and adapted to improve the effectiveness of cancer screening efforts. These activities are often in a clinic setting, but they can also be adapted to a non-traditional setting like in a community organization. The best thing about this is that if you really have an idea that you don't know all the things that you might need to consider or what roadblocks you might run into, what challenges, this is a great way to kind of look into some of those and get ideas on what others have done. So community clinical linkages are ways to help reach women who aren't already in the health system. And what do I mean by that? So earlier I mentioned that 86% of our residents have insurance, but our statewide screening rate is only 59%. So this means that even those who have insurance aren't getting their recommended cancer screenings. So a lot of the times we'll hear that people don't go because they can't afford it. Well, that's not necessarily the case. Actually, 33% of adults reported that they don't even have a personal doctor or a healthcare provider that they go to. And only 13.5% of adults said that they don't go to the doctor when they need to, regardless of the cost. Sorry, went too fast there. So in order to increase the screening rate statewide, we have to identify people where they're at. So, the Union Wireless commercial says where they live, work, and play. And that's reality. They might not already be in the healthcare system. And so in addition to doing projects where you're in a healthcare system, we could be looking at other places to gather to reach these women that aren't going in for their screenings. So the next thing we're going to be talking about is a barrier. Barriers are anything that stops a patient from completing their cancer screening. So this could be that they aren't able to call and make an appointment. Maybe they don't understand the process. Maybe they don't speak the language. Maybe they don't have a car to get to an appointment, or they can't take time off from work. They could also need help with filling out the paperwork. We are talking a lot about mammograms, and for women, most of the time they're the primary caretaker for their home. And so sometimes they can't find childcare or somebody to take care of the things at their house that they're going to miss while they're at their appointment. Some people don't trust the medical community, and other people don't understand the test and why it's important. So research shows that by implementing a combination of activities that are meant to reduce those barriers or things that are stopping people from getting their medical screenings, they saw an average of 17% increase in their cancer screening rate. One of the easiest ways that we see reducing barriers is by hosting these screening events outside of normal office hours, such as in the evening or on weekends. So some of the things that we've seen specifically in Wyoming, one radiology facility opened up in the evening and they had enough time slots for 14 mammograms. And the attendees that came were asked to complete a card that just had their name, their age, if they'd had a mammogram, if they were needing help paying for the mammogram, and those women were kind of assessed. So if they were needing help with a mammogram and needed a mammogram, they were placed in a box and they randomly drew 14 names out of that box. After that night was done, they actually took the rest of the names and their navigator worked on calling those women over the next several months to get them scheduled for an appointment. Anybody that wasn't needing a mammogram that night, that just came for the educational piece, they got pampering things like manicure or a massage. Maybe there was just wine and food at the venue. So they were just able to like network with other people and just really be there for the cause. Another community hosted their screening event at the rec center, and the provider donated their time to complete clinical breast exams. So anyone needing a mammogram after that exam, they were escorted to a scheduler who assisted them with their appointment being scheduled. If they needed help with paying for the mammogram, they were then taken to somebody else that would help them apply for assistance. We have other providers who open up their clinics on weekends, and they do a very similar process where they'll do the clinical breast exam. They have the scheduler there and financial assistance. They offer snacks, pampering, and raffle baskets at their event. We've had other events that offered a translator on site that would help people who didn't speak English. We've had other partners that had a navigator call people ahead of time to help them get their paperwork started so that when they came in for their appointment, they'd have everything ready to go. We've had one partner work with a local church, 4-H club, and school organization to provide free daycare during their screening event. And we've even had one partner that offered Uber and taxi rides for those needing transportation to the event. So the idea here is really to be creative and work with the organizations in your community to see what draws people in. And once you have them in the door, make sure that you do something with them, right? It's all about screening them and getting them that service that they need. So it's giving them the opportunity to do it on the spot. Another way to increase screening compliance is to help with out-of-pocket costs. So traditionally, when we think of out-of-pocket costs, we're thinking about the price associated with the mammogram, but it actually could also be things like the travel cost and time off from work. So thankfully in Wyoming, we actually do have quite a bit of providers or people that are working on offering those types of resources. The Wyoming Cancer Program and the Wyoming Breast Cancer Initiative partnered together in 2018 for the mammogram voucher program that most of you are probably very familiar with. Residents just have to complete an application for that service and they'll receive an ID card in the mail. That ID card works very similar to an insurance card, and the provider simply submits a claim for the services they provided to that person. If you are hosting a community screening event, we're always happy to provide staff to sign people up for that coverage. But you can also consider utilizing things like your community grant funds or your radiology facility donating a certain number of mammograms. So the research on this shows that by implementing these types of activities, you can increase your screening rates by around 11%. Client reminders are also helpful in increasing screening rates. Often when we say reminders, most people think about appointment reminders. But in this case, it can mean a few different things. It can mean reminding somebody that they're due for a mammogram. It could also remind somebody who hasn't completed their orders yet. It could be pulling a report for missed appointments and reminding those people that it's time to schedule. It could also be looking ahead into the future to see who's turning 40 soon and sending them a reminder that they should schedule their mammogram as a birthday present. I mean, who doesn't want that for their 40th birthday? So nationally, the evidence shows that by implementing these types of activities, clinics have seen an increase of 14% in their screening rates. And for this topic, we actually have some Wyoming-specific data too. So we have a clinic in Natrona County that's currently working on client reminders. And in their first quarter of implementing these activities, they were able to increase their screening rate by 8%. We have another clinic in Park County who increased their screenings by 13% over the span of a year. So oftentimes we also talk about patient navigation. And again, we kind of think about once somebody is diagnosed with cancer, but in this instance, it can mean both. You can navigate women to get their screening done as well as navigating them through their cancer treatment. A lot of times people don't really understand the healthcare system. They don't understand why this test is important. They don't understand prevention. They don't understand what their insurance covers, what the risk of this procedure is. And so really having someone that can spend that time to go through this with them on a one-on-one level, it's really important to making sure that they understand why they're needing this mammogram done. Studies show that when navigation is implemented in the setting, it can increase your screening rates by 14%. So these things, I mean, 14% might seem like a small number, but it is connecting to the audience that really needs that extra initiative. So as we all know, no matter how hard we focus on prevention, screening, and early detection, there will always be new cancers diagnosed. So when it comes to supporting those actively going through cancer treatment and those who are in remission, they really need that compassionate support, that caregiver level. So these community grants have also helped fund things like boutiques and support groups. And Wyoming has some really unique needs in this area because of the vast emptiness and the distance that it takes to get from one community to another. And so transportation is, again, an issue for people actually being able to go connect with other survivors. So we've had people that do virtual support groups, in-person support groups. We fund things like the Casting for Recovery. It's just an opportunity to look at your community and see what it is that you need. Look at what type of gaps you have in your community, what might not be offered, and explore things that might be beneficial to offer the survivors in your community. So with that, I will open it up for questions and brainstorming. If you have something that you want to share about what you've done in your community grant that you thought was really effective or helpful, that would be great to share. So feel free to use the chat box or raise your hand and come off mute. I'm going to stop sharing my screen so that I can see you all.
So Star, this is Kelly.
Kelly?
I first want to thank you so much for putting on this webinar and educating our community about the various types of grant opportunities out there and our needs. So, and also for our collaboration with the Department of Health. So you guys do wonderful work, and we couldn't do it without you. So thank you.
I know that was a ton of information. So definitely the recording will be available online as well as the slides. And I'm going to put those links in the chat box right now, like I promised.
Hi, Star, it's Cindy talking. I don't know if I have visual or not, but this year I received a grant and we promoted breast cancer awareness at our farmers market. It really went well. We had some really cool bags made. We gave some information about breast cancer screening in the little plackets that you gave me that people could use to get information about screening. We gave our little cake pops away. We had some t-shirts that we gave away. It was really fun. It was like everyone that passed us came over. So we probably impacted, several hundred people with our little booth. That was so much fun. And then next year we decided we were going to promote our breast cancer awareness screening at our rodeo. So that's going to be fun too.
Yes, I would love a cake pop.
Yeah, they were pink. They were darling.
Oh, that's very nice. Definitely. Yeah. So education is a really key important part of this as well. And, some people, we definitely feel in October that if you see the color pink, you know that it's about breast cancer awareness, but that's not always the case. Some people may not have the same access to technology, to internet, to television. So they may not see the same promotions that we all see every day and go, yeah, I know I need to get my mammogram done. So I definitely think having the education out in areas where the community members are is definitely important to have, so that you can connect those people who might not get it other places.
Yeah, and I'm also really appreciative of you guys always being available. Like if I have questions or I come upon someone who, I'm not so sure about, or just have questions about her care. You guys are always so approachable. You, Tanya, whoever I need to contact, you guys are just always there for me. So I really appreciate that too.
Thank you so much for saying that. I appreciate it.
This is Jessie Wagner. I'm just piping in here. I'm from outpatient radiology for those that I don't know, but I know Star and I know Dama and Kelly are on here. I just wanted to speak to what we've done already and then what we kind of looked forward towards the future. One of the greatest things that we have done, I can't do and put enough thanks to Dama for helping us do our brunch and breast event. That was insanely successful. We've done nothing but have growth in the screening rates from that. We grew from the first event, I think we were able to do 18 screening mammograms, and this year we did 38. So it was really successful. And almost all of them were a part of the applied for and received the breast and cervical coverage at the time of their imaging. So it was really great. And then we did a hockey event, which was, we kind of did it on the fly. We put it together in about 3 weeks after one of my staff members came up and asked if we could do something to pink the rink. And that was one of the most successful things we've done. So we're going to hope to grow that event next year. But what we're looking to do this next year, I heard Cindy mention the rodeo event. And we talked about this a little bit with Kelly. We are looking next year to be involved with the CNFR because of how many people attend that from the rural setting. That we're seeing is that deficiency in compliance in screening mammograms. And so if anybody has any experience with doing rodeo events or any advice, I'd love any information on that. Other than kind of, I think we want to do like a sponsorship. We want to have a booth where people can do, come and get their information and then get them screened, get them resources, get them all that stuff on site. So I don't know if anyone has anything that would be able to add to that. We would love to hear your input.
Hi, this is Tish. I'm Jace with the Wyoming Foundation for Cancer Care.
Yeah.
Addressing the Jessie and the rodeo, we do the Tough Enough to Wear Pink event at the rodeo.
Okay.
And, I'd love to talk to you. I can't today, but
Sure. Oh yeah, me neither, but soon, please.
next week, if you want to just give me a call. I know you know Stacy. And Barry has my number too.
Oh yeah, I have it too from all the stuff we just recently did with you.
Yeah. And I would love to talk to you about, well, we can kind of get together and see what we can do as far as you joining our area for Tough Enough.
Oh, that would be amazing. Thank you.
Okay. I'm going to mute me back again.
Okay.
See, this is exactly what we mean by coming together and connecting and sharing those resources. Because there's not a lot in Wyoming, but the people that we do have here, they're very passionate. And so it's great when we can actually connect and say, hey, let's do this together, because then we have a bigger reach when we're able to join forces.
Thank you guys.
I have to add something from Jessie. We at the Brunch and Breast, we added a therapy dog for the first time, certified therapy dog this year. And the amount of help that amazing animal provided to a lot of really anxious patients, I would recommend, if you are able to add something like that to your events to help with the anxiety. We had a couple ladies who were crying and very anxious, and he went right up to them and calmed them down. So it was a big help.
I love that.
I have to say one more thing. The breast and brunch that they're talking about, I know all of maybe 10 people in Wyoming, and 3 people called me from that event that I actually knew and said, hey, we're at such and such, and sent pictures and video. I thought it was really cool.
Oh, that's so exciting to hear that. Thank you for sharing.
Any other thoughts, questions? Perfect. Well, we look forward to seeing the community grants that come in. And I think Kelly, can you speak to the timeline of those and when they're going to be published and where they can find that information?
So if you go to the wyomingbreastcancer.org website, under grants, we'll have a link to apply for the grants, community grants. Those go live on December 1st. So you have the whole month of December, the whole month of January. They are due January 31st. And I wanted to add too, we now have a mini grant. The mini grant is, you can apply for it, just a quick little mini grant. It's a shortened version as far as the application and the reporting. And it's up to $2,000. It's a one-time, or it's one time per year per applicant. If you just have something you just want to fund on the go, you can do that. Actually, we're kind of doing a trial. It's going to be on a little trial basis. So if there's anyone that wants to kind of be our guinea pig and give that a go, you can reach out to us and we'll get you that link.
Perfect. Any other questions? Thank you all so much for joining today.